Hi everyone, my name is Wesley, and in today's video, I'm going to talk about one of the most mysterious and obscure mental conditions, and that is obsessive compulsive disorder. It is commonly known as OCD. In this video, it will first cover the medical statistics of OCD in Australia, including the number of people being affected, their age, and sex. And then it will move on to the overview of challenges that the OCD patients are facing every day, such as the symptoms that persist and the severity of the symptoms. The third part of this video, we're going to talk about recovery nursing interventions. And as a beginner RN, when we're dealing with patients with OCD, is different from a psychiatrist. And last but not least, I will provide an outline of one of the current Australia service that is designed to help the patient with OCDs and improve their conditions. So without further ado, let's get into our first point. So the figures. According to the Australia Bureau of Statistics 2007, there is 1.9% of Australians are affected by the symptoms of OCDs in a 12-month period. And researchers also shows that there is no discrepancies between gender and age. And however, this number changed significantly in the 2020 report, as we can see from the graph. It has changed to 2.3% for male and 3.2% for females. And in just over a little bit of a decade, we can see a trend. We can see the trend is moving towards women, and this shows us an urge in the society to just sort of correctly look at these problems. And when we look at OCDs and when we want to figure out how patients will behave either in daily life or at the hospital, we first have to understand how what OCD really is. Obsessive compulsive disorder, just like the name suggested, it has two parts. One is the recurrent unwanted thought, and that's the obsession part of it. And this is the part that causes anxiety. And the compulsion part of it is the action or the ritual that the patient wants to perform in order to alleviate their anxieties. OCD patients don't have to have the two disorders together to be diagnosed as OCD, but the majority of the cases, the two disorders will come in pairs, and the obsession will always be leading the charge. One misconception that people always have is they usually use OCD as to describe people who like to organize their things and keep their space tidy and clean, but that's not the case. Just like how I mentioned on the PPT, if you just want your things to be clean and tidy, if you want everything to be in order, if you just want to double check if the doors are locked after you left the house, that's not OCD. What OCD really is, what OCD really is it usually comes with a obsession, and they would tend to have a frequent intrusive thought over one particular things, and there's always a trigger. The most common areas are dreams, making mistakes. Some people might have religious problems and sexual relationships and etc. And the compulsive acts that come with it are usually meaningless or sometimes even harmful. The real suffering here is that the patient themselves not only know about those users' actions, but they know it really well not to do it. However, they just can't stop thinking about doing it because the obsession is just driving them crazy. And those acts usually takes hours in a day to finish, and that's a real challenge for people with OCD to live in a normal daily life. That's why sometimes when people are consulting with the doctor, they genuinely know that they are doing some sort of meaningless act. But because those intrusive thoughts are driving them crazy, they just have to perform the rituals and they have to follow the compulsions in order to relax. And people sometimes can usually clearly identify those unwanted thoughts and use as actions. But the difficulties are they can't control the anxieties that arise from those thoughts. Okay, so the next part, I'm going to talk about the recovery approaches to the OCD patients. As a beginner RN, it is very important to to understand the feelings, and it just like some of the medicines that treat the chronic disease, we as a beginner RNs have to start off this very slowly, and we need to acknowledge the patient's obsessions and understand their frustrations. Now, when dealing with their compulsions, I think it is necessary to allow the patients to perform it as long as the compulsion is within management and is not harmful. Sometimes stopping a patient from doing the compulsion activities may lead to an extreme mental breakdown just because the anxiety is unmanageable. Another approach is to educate the patient to adjust the ratio of the negative thoughts. When those intrusive thoughts pops up in some patients' mind, they tend to translate them into a more negative context. For example, when an OCD patient thinks of germs on their hands, they will sometimes have the anxiety of getting extremely sick or infecting their loved ones. So as a nurse, we need to educate them that this appraisal of thoughts are not correct. We need to tell them that a small amount of germs won't do anything bad, just like there is a small amount of germs on my face, and my face is just doing fine. So another approach can be planning diversional activities because these are the good ways to distract OCD patients away from those unwanted thoughts. This kind of activities can involve their families, and it is very important to explain and educate the patient's conditions to the family so that the patient and their family is being open-minded to what LCD really is. And family support is really important in mental health conditions. Um, it is very important not for the patients to feel embarrassed to talk about their conditions. And lastly, I would like to wrap up my video by introducing Sane Australia to all those OCD patients out there. It is a national charity that dedicates themselves into helping those who are living with mental problems. It offers a lot of helps on the website, and those supports includes counseling support, peer support, articles that address the issues of mental illness, and it also has a full educational channels for OCD patients as well. So I have the link and contact number and emails above. And yep, and thank you very much for listening to my whole video, and stay safe and wash those hands.